You know that feeling, right? When your pet just seems off. Maybe they're moving a bit slow or breathing kind of funny, too fast maybe, or
Hmm.
that awful moment when they suddenly collapse. It's just sheer panic.
Oh, it absolutely is. A really, really unsettling feeling. And in those first few seconds, those minutes, just having a basic idea of what might be happening, it can be, well, incredibly helpful for you and honestly, potentially life-saving for your pet.
Exactly. And that's what we're really diving into today. Look, this isn't about making you a vet, obviously. It's for any pet owner who just wants to be a bit more informed,
Hmm.
more prepared.
Yeah.
We're doing a deep dive into emergency heart situations in our pets, our small animals. Think of it like getting the key insights into what vets are thinking, what they're looking for when a pet comes in with a cardiac crisis.
We've been looking through a whole stack of emergency protocols, haven't we? Covering things like weird heart rhythms, heart failure, collapses.
Right. The whole range.
Yeah.
And our mission here is just to pull out the really crucial stuff, the need-to-know bits. So if, heaven forbid, you face this, you've got a clearer picture of what's likely going on.
And what's kind of fascinating but also critical about heart emergencies is just how fast things can develop. Catching those first, maybe subtle signs, that can make a huge difference. So maybe let's start with arrhythmias. When the heart's rhythm goes a bit haywire.
Okay, yeah, let's unpack that. Arrhythmia, basically an abnormal heartbeat. And our sources really stress that, like, super fast assessment is crucial.
Mm.
So from an owner's point of view, what are the things we might actually see? The initial red flags?
Well, the protocols point to a few key clinical signs to watch for. Things like sudden weakness just appearing out of nowhere. Any kind of collapse or fainting spell vets call that syncope.
Syncope, right?
Yeah, or just noticeable lethargy, being really tired, or any sign of trouble breathing faster, or it looks like more effort.
Yeah.
And in the most severe cases, it can unfortunately even lead to sudden death.
Wow. Okay, that's, tough.
Right.
So if we see those signs, what's the absolute first thing a vet's going to check when we rush our pet in?
That initial triage is all about the cardiovascular system. So they'll be carefully checking the heart rate. Is it too fast, too slow? Does it feel irregular?
Okay.
They'll look at the gum color. Are they pale? Or maybe bluish, cyanotic. That suggests not enough oxygen is getting around.
Makes sense.
Then there's the capillary refill time. You press on the gum, see how fast the pink color comes back. If it's slow, more than a second or two, that points towards poor blood circulation.
Right.
And finally, feeling the pulse. Is it strong, weak, irregular, or maybe even absent?
Okay, so that's the quick hands-on check. What happens, like, immediately after that? What are the first steps to try and stabilize the pet?
Right, stabilization. The protocols are clear. Oxygen first, especially if there's any breathing issue or sign of low oxygen.
Makes sense.
Getting an intravenous line, an IV placed, is vital. That's the route for fluids, for medications, quickly. Continuous heart monitoring with an ECG, an electrocardiogram, is absolutely essential to see exactly what the rhythm is doing.
Right, to identify the specific problem.
Exactly. And maybe one of the most important things initially, keeping the pet calm. Stress can actually make arrhythmias worse, so minimizing stress is huge.
Okay, that makes a lot of sense. So initial check, stabilization. Then the ECG really helps pinpoint the type of arrhythmia. Our sources mentioned a few key ones. Let's start with atrial fibrillation, AF.
Right.
What does that look like on the ECG? What are the telltale signs?
Atrial fibrillation, or AF, is interesting. It's like the top chambers of the heart, the atria, are just quivering chaotically instead of beating properly. The rhythm is described as irregularly irregular.
Irregular, like completely random.
Pretty much. There's no predictable pattern. On the ECG trace, you won't see those nice, clear P waves that normally signal the atria contracting. Instead, you might see these sort of messy, squiggly lines. And the bottom chambers, the ventricles, they're responding fast, but also unevenly.
Okay, so the top's chaotic, the bottom's trying to keep up, but
Yeah.
it's messy too.
Yeah.
Got it. What about the next one? Ventricular tachycardia, VT. What are the key ECG features there?
Yeah, VT is different. Here, the problem starts in the lower chambers, the ventricles. The main things you look for on the ECG are wide QRS complexes. Those spikes that represent the ventricles contracting look wider, more spread out than normal.
Wider spikes. Okay.
And the heart rate is usually very fast, often over, say, 160, maybe even 200 beats per minute in dogs. The rhythm itself might be regular, or it could be irregular too. But because it's coming from those main pumping chambers, it's often more worrying for blood output.
Yeah, that sounds serious. He's quick action. Now, flipping to the other extreme bradyarrhythmias, heart rate too slow.
Mm-hmm.
What's the definition there, and what are some examples?
Right, Brady means slow. So bradyarrhythmias are just that heart rate is too slow. Generally, we're talking under 60 beats per minute in dogs, maybe under 120 in cats, depending on the situation.
Okay.
Examples. Well, there's sinus bradycardia, where the rhythm looks normal on the ECG, just slow. Then you have things like AV block, atrioventricular block. That means there's some kind of delay or block in the signal getting from the top chambers to the bottom ones.
So a communication breakdown in the heart's wiring.
Sort of, yeah. And then the most extreme is asystole, that's flatline. No electrical activity at all. The heart has stopped.
Okay, so the ECG gives that immediate electrical picture.
Yeah.
But our source is stressed. You also need to figure out why it's happening. What other tests are crucial?
Oh, absolutely. You need the bigger picture.
Yeah.
Blood work is essential. A CBC, a chemistry panel that checks organ function, looks for infections, other issues.
Right.
Electrolytes are super important. Potassium levels especially can really throw off heart rhythm if they're too high or too low.
Oh.
Then there are cardiac biomarkers, things like NT-proBNP and troponin I. These can indicate if there's actual damage or stress to the heart muscle itself.
Like a blood test for heart strength.
Exactly. And imaging is key too. Chest x-rays, they let us see the heart's size and shape, and crucially check for fluid in the lungs.
So it build up, yeah.
And an echocardiogram, that's an ultrasound of the heart. It gives a really detailed look at the heart structure, the chambers, the valves, how well it's pumping.
So it's a whole package deal, electrical picture, blood tests, imaging. Makes sense.
Yeah.
Okay, once they know the type of arrhythmia, what are the first treatment goals? Let's cycle back atrial fibrillation, AF.
With AF, the main initial goal is usually to slow down that rapid ventricular rate, how fast the bottom chambers are beating. If you can slow that down, the heart can fill better and pump more effectively. The protocol mentions using drugs like intravenous diltiazem, for example.
Okay, slow it down. And for VT, ventricular tachycardia, that fast, dangerous one.
For VT, the goal is to stop that abnormal rhythm, get it back to normal as quickly as possible because it can be life-threatening. Intravenous lidocaine is often the first choice, especially in dogs.
Stop the dangerous rhythm. Got it. And for the slow ones, the bradyarrhythmias.
Well, if the slow heart rate is actually causing problems like making the ped weak or collapse, then the goal is to increase the heart rate. A drug like atropine might be used for certain types of slow rhythms to try and speed things up.
So it really depends on the specific electrical issue. Very targeted.
Okay, let's shift gears a bit. Another huge emergency, congestive heart failure, especially when there's fluid buildup.
Yes, CHF. This is unfortunately really common. The big emergency here is when that failing heart leads to fluid accumulating where it shouldn't, either inside the lungs, that's pulmonary edema,
Fluid in the lungs, right.
or in the space around the lungs, which is pleural effusion. Both make breathing incredibly difficult.
And what are the big warning signs an owner might see at home if this is happening?
Breathing is the key. You'll probably see them having obvious trouble breathing really fast, like over 40 breaths a minute when resting.
Wow, that fast.
Yeah. And you might notice them adopting a specific posture, sitting or standing with their elbows out, neck stretched out, trying to get air in. That's called orthopnea, a classic sign. Sounds awful to watch. So when they get to the vet like that, what's the vet listening for with the stethoscope?
Listening to the chest is critical. If there's pulmonary edema, fluid in the lungs, they might hear crackling sounds, sometimes wheezing.
Okay.
If it's pleural effusion, fluid around the lungs, that fluid can actually muffle the normal lung sound, so the sounds might be quieter, especially lower down in the chest. And again, checking gum color pale or blue is a bad sign.
And what are those absolute first things the vet team does to help a pet struggling like that?
Priority 1 is supporting their breathing and reducing stress. Any stress makes it worse. So oxygen is absolutely paramount.
Oxygen right away.
Keeping them comfortable, often letting them stay sitting or standing upright if that's how they seem most comfortable breathing. Gentle sedation might be used too, drugs like butorphanol, maybe low-dose spromethazine, just to ease anxiety and reduce the body's oxygen demand.
Okay, calm, oxygen, comfortable position. What about diagnostics? How do they confirm it's CHF with fluid?
Several tools are key here. Chest x-rays are vital. They can show that classic cloudy look of fluid in the lungs or fluid outlining the lungs in the chest cavity, often making the heart look big and round too.
X-rays are crucial then.
Definitely. And point-of-care ultrasound, POCUS, is incredibly useful now. You can do a quick scan right there, and often see signs of fluid in the lungs. They look like things called B lines or see fluid around the lungs very quickly. You can even get a quick peek at the heart function.
Wow, ultrasound right there at the bedside, basically.
Exactly. An ECG is important too, to check for arrhythmias that often go along with CHF, like AF or fast ventricular beats. Blood pressure needs checking. Blood work, including those cardiac biomarkers we mentioned, NT-proBNP, troponin.
Checking the heart strain again.
Yep. Measuring oxygen levels directly with arterial blood gas or pulse oximetry.
Okay.
And if they suspect pleural effusion, doing a thoracocentesis, putting a needle in the chest to draw off fluid, is both diagnostic, you can analyze the fluid, and therapeutic. It helps them breathe immediately.
Right, draining the fluid gives instant release. So lots of tools to get the full picture. Now, treatment, if it's pulmonary edema, fluid in the lungs, what's the approach?
Okay, for pulmonary edema, keep the oxygen going. Diuretics are key drugs like furosemide, usually given RV, to help the kidneys pull off that excess fluid.
Get rid of the fluid.
Exactly. Medications to open up blood vessels, like nitroglycerin paste on the skin, can help reduce the load on the heart. And drugs to help the heart muscle pump stronger, like pimobendan, often given as a tablet if they can take it, improve the heart's output.
Okay, and if it's the pleural effusion, fluid around the lungs.
For significant pleural effusion, the main immediate treatment is that therapeutic thoracocentesis we just talked about. Physically removing the fluid is the fastest way to help them breathe better.
Just drain it off. Got it. Our sources mentioned being careful with IV fluids and also ACE inhibitors. When do those fit in?
Yeah, IV fluids have to be used very, very carefully in CHF patients with fluid overload. You don't want to add more fluid to the system, right?
Right, makes sense.
But if the pet is also showing signs of shock, like really low blood pressure, some fluids might be needed, just given very cautiously. ACE inhibitors, like enalapril, are meds that help relax blood vessels and reduce heart workload. They're often started later, once the pet is more stable, or if they also have high blood pressure.
Okay, so it's a real balancing act based on the individual pet.
Right.
Let's switch again to something really scary for owners. Fainting or sudden collapse. Syncope versus cardiac arrest.
Yeah, seeing your pet suddenly faint, that syncope, a brief loss of consciousness, or worse, a collapse completely, potentially in cardiac arrest. It's terrifying. The absolute first thing is to figure out, was it a quick faint and they recovered? Or is it something much worse, like a seizure or their heart actually stopping?
How do vets tell the difference in those first critical seconds?
The immediate check is ABCs, basically. Airway, is it clear? Breathing, are they breathing? Circulation, is there a heartbeat? Is there a pulse? That's the crucial distinction.
Okay, and if it was just syncope, they fainted, but they are breathing, they do have a heartbeat.
Yeah.
What's the immediate care?
For syncope, the main thing is safety and recovery. Place them gently on their side in a quiet area so they don't injure themselves if they're still a bit wobbly. If they seem to be struggling to breathe even after they wake up, then oxygen would be given.
Okay, now the worst case, cardiac arrest, heart stopped, CPR. Our sources outlined it. Can you give us the sort of condensed version of what CPR involves for a pet?
Right, CPR. It's broken down into basic life support, BLS, and advanced life support, ALS. BLS is what can be started immediately. It's focused on chest compressions.
Compressions, okay. How fast? How deep?
The rate should be fast, about 100 to 120 compressions per minute. And you need to press down firmly, compressing the chest by about a third to a half of its depth. And really importantly, don't stop compressions for more than about 10 seconds at a time. Keep them going.
Continuous compressions are key.
Absolutely. Then there's airway and breathing, making sure the airway is clear and giving rescue breaths, ideally with 100% oxygen if possible, about 10 breaths per minute. If you're doing it alone, the cycle is usually 30 compressions, then 2 breaths.
30 to 2. Okay. That's BLS. What about ALS, advanced life support?
ALS brings in more advanced stuff, getting that IV access, or sometimes intraosseous IO, access a needle into the bone marrow for giving drugs.
What kind of drugs?
Key drugs are epinephrine, usually given every 3 to 5 minutes to try and restart the heart, and atropine if the underlying rhythm is very slow. Defibrillation is also part of ALS, that electrical shock, but it only works for specific rhythms like ventricular fibrillation or pulseless VT.
Not for flatline. Systole.
No, defibrillation doesn't help a systole. During CPR, monitoring is crucial too, using the ECG to see the rhythm, and something called capnography, which measures CO2 in the breath, helping gauge how effective compressions are. And if they do get the pet back, post-resuscitation care is super intensive. Close monitoring, careful fluids.
Wow. A huge effort. So after the immediate crisis, whether it was syncope or arrest, how do they figure out the underlying cause?
Yeah, finding the cause is critical to prevent it happening again if possible. Starts with a really thorough physical exam, listening to the heart, checking pulses again, neurological assessment, hydration.
Uh-huh.
Point of care tests are great for quick answers. ECG, again, maybe quick chest x-rays, blood gas or pulse oximetry for oxygen, blood pressure.
The quick checks.
Yep. Then lab work, CBC, chemistry, those cardiac biomarkers, again, troponin, NT-proBNP, coagulation tests sometimes. And for more tricky cases, maybe advanced things like a full echocardiogram or even a Holter monitor that's like a portable ECG the pet wears for 24 hours or more to catch intermittent problems.
Okay. And treatment then obviously depends entirely on what they find.
Exactly. If syncope was caused by an arrhythmia, they treat the arrhythmia. If it was low blood sugar, they give glucose. Low blood volume, fluids. Pulmonary hypertension needs specific meds. For cardiac arrest, well, treatment is the CPR protocol, hoping for a return of spontaneous circulation.
Right. Okay, let's move to another condition. This one involves pressure on the heart itself, pericardial effusion and cardiac tamponade.
Ah, yes. Pericardial effusion means fluid building up in the pericardial sac, the little bag around the heart. Cardiac tamponade is the emergency that happens when there's so much fluid that it squeezes the heart and stops it from filling up properly with blood between beats.
So the heart literally can't fill because it's being squished.
Precisely. It's a major life-threatening emergency because the heart can't pump blood effectively.
What signs might point towards this? What would an owner see or a vet find?
Signs can be pretty dramatic. Weakness, collapse again. When listening to the heart, the sounds might be muffled, distant because of that fluid layer.
Muffled heart sounds, okay.
You might see the neck veins bulging, jugular vein distension, and the pulses might feel weak, and strangely even weaker when the pet breathes in. That specific sign is called pulsus paradoxus. They might also be breathing rapidly or with difficulty.
And what about the vital signs? What would the vet typically measure?
Key findings are usually a fast heart rate, tachycardia, and low blood pressure, hypotension. The heart's beating fast trying to compensate, but it can't fill, so the pressure drops.
Fast heart, low pressure, muffled sounds, weak pulses. Okay. How do they stabilize a pet like this initially?
Again, oxygen is important. Positioning can help sometimes. Letting them sit upright takes a bit of pressure off. Minimizing stress is absolutely critical here. Any extra stress can push them over the edge.
Avoid stress.
Yeah.
Got it. And the main diagnostic tool to confirm this, you mentioned POCUS before.
POCUS is absolutely the key here. It's the fastest, most reliable way to actually see the fluid around the heart. And crucially, you can see if the heart chambers are actually collapsing inwards when the heart tries to relax and fill. That's the visual confirmation of tamponade.
So ultrasound is definitive pretty much.
It really is in this case. An ECG might show some suggestive signs, like that electrical alternans where the height of the ECG waves varies beat to beat or just overall low voltage signals. Chest x-rays, if they're stable enough, might show a big, round, globe-shaped heart silhouette. But ultrasound is quickest and best.
And the life-saving treatment is pericardiocentesis, draining the fluid. Tell us about that.
Yes, pericardiocentesis is the definitive treatment for tamponade. It involves carefully inserting a needle, usually guided by ultrasound if possible, through the chest wall into that fluid-filled sac around the heart.
Sounds delicate.
It is. Usually done on the right side of the chest, between the ribs. You gently aspirate, pull out the fluid. And as the fluid comes off, you often see immediate improvement as the pressure on the heart is relieved. But you have to monitor super closely during and after. For complications, arrhythmias are common, risk of hitting the heart muscle, potential for shock.
Right. And after they drain the fluid, what's next?
Post-procedure monitoring is intense. Watching heart rate, rhythm on the ECG, blood pressure very closely. Often repeat ultrasounds to make sure fluid isn't building back up too fast. Cautious the fee fluids might be given to help support blood pressure now that the heart can actually fill better.
And like with arrhythmias, you need to find the cause of the effusion, right? Why did the fluid build up?
Absolutely essential, because it often comes back if you don't treat the underlying cause. Possibilities include, sadly, cancer, quite often tumors like hemangiosarcoma or chemodectoma. But it could also be infection, inflammation. Sometimes it's idiopathic, meaning we don't find a specific cause, or sometimes related to right-sided heart failure.
So figuring out the why is key for long-term management.
Exactly. Treatment then focuses on that cause. Meds like antiarrhythmics or pain relief might be used as needed, but diuretics are usually avoided initially in tamponade as they could drop blood pressure further.
Okay. Final major topic, shock. This affects the whole body, doesn't it?
Yes, shock is a whole body crisis. It's defined as inadequate tissue perfusion, basically. Not enough oxygen getting delivered to the body's tissues because blood flow is compromised. It's life-threatening and affects all the vital organs.
What are the common signs of shock we might see in a pet?
The classic signs often include a fast heart rate, though cats can sometimes have a slow rate in shock, which is tricky. Weak pulses are common. Gum color can vary, often pale, but sometimes very bright red, especially in septic shock. Capillary refill time might be slow, or sometimes really fast. Flash CRT. Body temperature is usually low, and their mental state is often altered, dull, confused, unresponsive.
Right. And our sources mentioned different types of shock. Can you quickly distinguish them?
Sure. There's hypovolemic shock, that's from losing fluid volume, like major bleeding or severe dehydration. Think cold extremities, slow CRT, weak pulses.
Pulse volume. Yeah.
Cardiogenic shock, that's when the heart itself fails as a pump. So you might find signs of heart disease like murmurs, arrhythmias, maybe fluid in the lungs, jugular distension.
Heart failure causing shock.
Right. Septic shock caused by overwhelming infection. This one can look different initially, sometimes very red gums, stronger bounding pulses, often a fever.
Infection-driven.
Yep. And anaphylactic shock, a severe, sudden allergic reaction. Look for things like swelling, hives, redness, severe breathing difficulty.
Allergic reaction shock. Got it. So different causes, slightly different signs sometimes. What are the immediate first steps for any pet in shock?
Immediate stabilization priorities are oxygen therapy, always. Appropriate positioning, usually lying down, maybe head slightly elevated for cardiogenic shock to help breathing. Getting rapid IV access is absolutely critical for fluids and drugs. And getting baseline vital signs immediately, heart rate, breathing rate, temperature, blood pressure to track changes.
IV access sounds like priority one. And diagnostics. What tests are run right away?
Key tests include blood work, CBC, chemistry, and importantly, measuring lactate levels. High lactate is a direct indicator of poor tissue perfusion of shock.
Lactate tells you how bad the shock is.
It's a very useful marker, yes. Blood pressure measurement is essential. Low BP is a hallmark. POCUS, again great for quickly looking for internal bleeding, heart issues, fluid. ECG for arrhythmias. Chest and abdominal x-rays might be needed to find the underlying cause. A coagulation panel is important, especially if sepsis or anaphylaxis is suspected. And arterial blood gas gives detailed oxygen and acid-base status.
Okay, comprehensive workup needed quickly. And the treatment then is very specific to the type of shock.
Absolutely. Tailored treatment is key. For hypovolemic shock, aggressive IV fluids, crystalloids, maybe colloids, possibly blood transfusions, and stop the fluid loss.
Fluids.
For cardiogenic shock, fluids must be very careful. Focuses on diuretics like furosemide, drugs to help the heart pump like pimobendan or dobutamine, treating arrhythmias, maybe pericardiocentesis if tamponade is involved.
Yeah.
Very different approach.
Careful fluids support the heart.
Septic shock needs immediate broad-spectrum antibiotics. Aggressive fluid resuscitation is still needed here. Often requires vasopressors, drugs like norepinephrine or dopamine to raise blood pressure if fluids aren't enough. Maybe low-dose steroids sometimes.
Antibiotics, fluids, pressure support.
And anaphylactic shock. Epinephrine is the #1 life-saving drug, given immediately. Then antihistamines, steroids, aggressive fluids too, and bronchodilators like albuterol if they can't breathe well.
Epi first for allergic shock.
Definitely. And across all types of shock, continuous intensive monitoring is vital. Watching vitals, urine output, lactate levels, fluid balance to see how they're responding and adjust treatment.
Wow. Okay, this has been incredibly detailed, a really deep dive into these critical cardiac emergencies. It just highlights how complex and how urgent these situations really are.
They absolutely are complex. And as we've sort of touched on throughout, just being able to recognize even those subtle early signs and getting prompt veterinary help, that is so, so crucial for giving our pets the best possible outcome.
Yeah, the big takeaway for everyone listening has to be really know your pet. Notice those little changes, breathing, energy, behavior. And if something feels wrong, just act fast. Don't wait.
Exactly. And please, everyone remember, this discussion gives you some background, some understanding, which is great, but it is absolutely not a replacement for professional veterinary advice. If you ever suspect your pet might be having a cardiac emergency, just get to a vet immediately. Time is everything.
Couldn't agree more. So on that note, thinking about everything we've covered, what aspect of emergency pet care are you most curious about now? What other urgent situations are on your mind? Maybe that's something we can delve into next time. Thanks so much for joining us on this deep dive.